Good day, everyone. Welcome to Module 2 of our mandatory 8-hour safety and health training. During our first module, we learned why occupational safety and health is important and what our rights and responsibilities are under the law. Now, we'll discuss something that every worker encounters every single day: hazards in the workplace. Remember this: hazards are everywhere, but accidents are not inevitable. Most accidents can be prevented if we recognize hazards early and control them properly. By the end of this module, you'll be able to identify workplace hazards, understand the risks they present, and apply the proper control measures before accidents happen.
Let's begin with the word hazard. A hazard is simply anything that can cause harm. It could be a machine, a chemical, electricity, noise, even poor posture. If something has the potential to hurt someone, then it is considered a hazard. Many people confuse hazard and risk. They are not the same. Think of it this way: a knife is a hazard because it can cut you. But if the knife is stored properly, the risk is low. If someone leaves it on the floor, the risk becomes much higher. Hazard is the source of danger. Risk is the likelihood that someone will actually get hurt. Hazards are classified into different categories. Understanding these categories helps us identify hazards more effectively. Let's discuss each one. Physical hazards are workplace conditions or sources of energy that can harm workers through exposure to physical agents or environmental conditions such as noise or unwanted or excessive sound from machines, equipment, or tools that can damage hearing and reduce concentration over time. Hazards from moving machine parts that can cause serious injuries. Poor lighting that can cause eye strain, mistakes, and accidents. Next are chemical hazards. Chemical hazards are substances that can harm a person's health, safety, or the environment through exposure. They may exist as solids, liquids, gases, vapors, mists, dusts, or fumes.
Without proper handling and control, chemical hazards can cause serious illness, painful injury, or even fire and explosion. These particles represent hazardous chemicals. Routes of exposure are the pathways by which they enter the human body.
The four main routes are inhalation, breathing in hazardous substances that enter the lungs and may affect your health.
Even with protective gear, accidents can happen. Chemicals can absorb through the skin and enter the bloodstream. Always wash exposed skin immediately.
Next, we have ingestion, swallowing hazardous chemicals through contaminated food, drinks, or unwashed hands. And lastly, injection. Chemicals enter the body through cuts, punctures, or needle stick injuries. Next are biological hazards. Biological hazards are living organisms or biological materials that can cause disease. Examples include bacteria, viruses, fungi, parasites, blood-borne pathogens, mold. Workers in healthcare, laboratories, food processing, agriculture, and waste management are commonly exposed to biological hazards. Good hygiene and proper PPE greatly reduce exposure. Next, let's discuss ergonomic hazards. These hazards result from poor workplace design or improper work practices. Examples include manual lifting, awkward posture, repetitive motion, forceful exertion. These hazards may lead to back pain, muscle strain, joint injuries, carpal tunnel syndrome, fatigue. Proper training, correct body mechanics, and appropriate workstation adjustments help reduce the risk of ergonomic injuries.
Ngayon na naintindihan na natin ang iba't ibang panganib sa trabaho, pag-usapan natin kung paano nangyayari ang mga aksidente at higit sa lahat kung paano natin ito maiiwasan. Every accident results from a chain of events. And if we identify and control these causes early, accidents can be prevented. Understanding accident causation helps workers recognize unsafe conditions and unsafe behaviors before someone gets injured.
Before we discuss accident causation, let us first understand what an accident is. An accident is an unplanned and unintended event that can result in injury, illness, property damage, disruption of work, or even death. It is important to understand the difference. An accident results in injury, illness, or property damage. An incident is any unplanned event that disrupts normal operations. Some incidents result in accidents, while others do not. A near miss is an event where no one was hurt, but someone easily could have been. For example, if a box falls from a shelf but misses a worker by only a few inches, that is a near miss. Reporting near misses is essential because they provide an opportunity to prevent future accidents. Immediate causes of accidents: unsafe or unhealthy act. An unsafe or unhealthy act is a human action that deviates from established job procedures, standard work practices, safety rules, regulations, or instructions. It is the violation of accepted safe work procedures or processes that increases the likelihood of an accident. Examples of unsafe acts include operating equipment without proper authorization, removing or bypassing safety devices, using defective or damaged equipment, failing to wear or improperly using the required personal protective equipment, PPE, engaging in horseplay in the workplace, and working while under the influence of alcohol or drugs. These unsafe behaviors significantly increase the risk of accidents, injuries, and property damage. Factors contributing to unsafe acts: improper attitude, physical limitations, lack of knowledge or skills. The next cause of accidents is an unsafe condition. An unsafe condition refers to the physical or chemical property of a material, machine, or the work environment that has the potential to cause injury to a person, damage or destruction of property, or other losses. These conditions are preventable and could have been eliminated, corrected, or properly guarded against before an accident occurred. Examples of unsafe conditions include inadequate guards or machine protection, excessive noise, inadequate illumination or ventilation, and extreme temperatures. Generally, studies show that 98% of workplace accidents are preventable. Approximately 88% are caused by unsafe or unhealthy acts, 10% are caused by unsafe or unhealthy conditions, and only 2% are considered non-preventable. One of the oldest and most famous accident theories is Heinrich's domino theory. Imagine 5 dominoes standing in a row. When the first domino falls, it knocks down the next one until the last domino falls. According to Heinrich, accidents occur in the same way. An unsafe act or unsafe condition eventually leads to an accident, which results in injury. The important lesson is this: if we remove one domino, especially the unsafe act or unsafe condition, the entire chain stops and the injury never occurs. When preventing accidents, we should always use the hierarchy of controls. It is a safety system used to reduce workplace hazards. It ranks safety measures from the most effective to the least effective. The most effective solution is to eliminate the hazard entirely. Eliminating the hazard means completely removing the source of danger from the workplace so that it can no longer cause harm. This is considered the highest level of control in the hierarchy of controls because it removes the risk at its source rather than relying on workers to avoid it or protect themselves. Next, we have substitution. Substitution is the process of replacing a hazardous material, chemical, process, or piece of equipment with a safer alternative that poses less risk to workers. While it does not completely eliminate the hazard, it significantly reduces the likelihood or severity of injuries, illnesses, and environmental harm by using a less hazardous option whenever possible. Engineering controls are the third most effective level of the hierarchy of controls. Instead of relying on people to avoid hazards, they reduce the risk by isolating workers from the danger through physical changes to equipment or the workplace. Engineering controls help prevent accidents and protect everyone more consistently. Administrative controls are workplace policies, procedures, and safe work practices designed to reduce workers' exposure to hazards. Instead of removing the hazard itself, they change how people perform their tasks to minimize risk. While administrative controls are less effective than elimination, substitution, or engineering controls, they play an important role in preventing accidents when combined with other safety measures. Personal protective equipment, PPE, is the last line of defense in the hierarchy of controls. It consists of specialized clothing and safety equipment worn by workers to reduce exposure to workplace hazards when risk cannot be completely eliminated or controlled by other methods. Common PPE includes hard hats, safety glasses, gloves, hearing protection, respirators, high visibility vests, and safety shoes. While PPE helps minimize the severity of injuries and illnesses, it is most effective when used correctly, properly maintained, and combined with higher-level hazard controls such as elimination, engineering controls, and administrative controls.
When each of us chooses to work safely, we protect not only ourselves, but also our coworkers, our families, and the future of our organization. Thank you for your active participation in Module 2. In the next module, we will continue building your knowledge and practical skills to help create a safer and healthier workplace.